Hello and welcome. Today we're diving into a serious condition called epiglottitis. This is a potentially life-threatening infection that affects the epiglottis, a small flap of cartilage that sits at the base of your tongue and protects your trachea, or windpipe, during swallowing. Understanding epiglottitis is crucial, so let's explore what it is, what causes it, and how it's treated. The most common culprit behind epiglottitis used to be the bacterium Haemophilus influenzae type B, often abbreviated as Hib. Thanks to widespread Hib vaccination, epiglottitis caused by this bacterium is now far less common. However, other bacteria, such as Streptococcus pneumoniae, Staphylococcus aureus, and various other Streptococcus species, can still cause the infection. In rare cases, viruses like herpes simplex virus or varicella zoster virus, the virus responsible for chickenpox and shingles, can also be involved. Occasionally, epiglottitis can result from physical trauma, such as swallowing a very hot liquid, inhaling smoke, or even a foreign object getting lodged in the throat. Normally, the epiglottis acts as a gatekeeper, preventing food and liquids from entering the trachea. When an infection takes hold, the epiglottis and surrounding tissues become inflamed and swollen. This swelling can rapidly obstruct the airway, making it extremely difficult to breathe. In severe cases, the airway can become completely blocked, leading to respiratory failure and, if not treated promptly, death. The rapid progression is what makes epiglottitis so dangerous. Before the Hib vaccine's widespread use, epiglottitis was most common in children between the ages of 2 and 7. Now, with the decline in Hib-related cases, epiglottitis is seen more frequently in adults. While vaccination has dramatically reduced its incidence in children, anyone, regardless of age, can develop the condition. Certain factors can increase the risk, such as being immunocompromised, having recent respiratory infections, or living in crowded conditions. The symptoms of epiglottitis can develop very quickly, sometimes within a matter of hours. In children, key signs include a severe sore throat, difficulty swallowing, dysphagia, drooling, a muffled or hoarse voice, and a high fever. They may also adopt a characteristic posture, leaning forward with their chin thrust out, trying to open their airway. Adults often experience similar symptoms, including a severe sore throat, difficulty swallowing, hoarseness, and shortness of breath. Stridor, a high-pitched whistling sound during breathing, is a particularly alarming sign indicating significant airway obstruction. It's crucial to seek immediate medical attention if you or someone you know exhibits these symptoms. Diagnosing epiglottitis requires a rapid and careful approach. A healthcare provider will begin with a physical examination, paying close attention to the patient's breathing and airway. However, aggressive examination of the throat may trigger complete airway obstruction and should be undertaken with caution, and only by experienced medical personnel prepared to intubate the patient if necessary. In many cases, lateral necks raise or a flexible fiber optic laryngoscopy, a procedure where a thin, flexible tube with a camera is inserted into the throat, may be used to visualize the epiglottis and surrounding structures. Blood tests, including a complete blood count and blood cultures, can help identify the presence of infection and the specific bacteria involved. While classifications or types of epiglottitis aren't typically used, it's important to distinguish between infectious and non-infectious causes. Infectious epiglottitis, as we've discussed, is caused by bacteria or viruses. Non-infectious epiglottitis is less common and can result from trauma, burns, or inhalation of irritating substances. The primary goal of treatment is to secure the airway and ensure the patient can breathe. In severe cases, this may involve inserting a breathing tube, either through the nose or mouth, endotracheal intubation, or in very rare and critical situations, performing a tracheostomy, a surgical procedure that creates an opening directly into the trachea. Once the airway is secured, intravenous antibiotics are administered to combat the infection. Corticosteroids may also be given to reduce swelling. Patients are closely monitored in an intensive care unit until the infection is under control and they can breathe independently. The most effective way to prevent epiglottitis caused by Haemophilus influenzae type B is through Hib vaccination. This vaccine is typically given to infants as part of their routine childhood immunizations. Maintaining good hygiene practices, such as frequent hand washing, can also help prevent the spread of other respiratory infections that can sometimes lead to epiglottitis. With prompt diagnosis and treatment, the prognosis for epiglottitis is generally good. Most patients make a full recovery without long-term complications. However, delayed diagnosis or treatment can lead to severe consequences, including brain damage from lack of oxygen or even death. Recent research focuses on developing rapid diagnostic tests for epiglottitis, improving airway management techniques, and investigating the role of emerging pathogens in causing the condition. Ongoing surveillance is also crucial to monitor the effectiveness of Hib vaccination programs and identify any potential outbreaks.